So I hope you don't get tired of my voice. And thank you for the kind introduction. I did come from the heart of the opioid epidemic. West Virginia still has the highest death from overdose in the country. And there's a lot of problems related to that and some things we could talk about. In general, Minnesota has had a lower rate of prescribing, and it's only really more so it's become more evidence of problem here in the past 5 or so years. I don't think it's related to me coming here, by the way. I don't think anything to do with that. So what I do want to share with you, I've been able to work on several committees here at Mayo that are both for Minnesota, our Minnesota branch and institution-wide, or the enterprise-wide, and also working with Minnesota collaboration. So I want to just briefly, again, talk about the opioid epidemic in the United States, and then more specifically about what's happening, how we're doing in Minnesota, and some ideas about understanding the collaborative efforts that are ongoing to address this, and what are some of the things that have been come up with so far about best practices for addressing opioid use disorder in patients on prescription opioid medication. So back to our questions. What do you think the percentages of adults who are prescribed prescription opioid medications report? How many of them report misusing those medications? All right, let's see what our guesses are. Okay, nice spread there. We'll see what the evidence shows. And the next question, which of the following is not a red flag for misusing prescription opioids? Ongoing workman's compensation claim, family history of substance use disorder and first-degree relative, positive urine toxicology screen concerning for other addictive behavior, or use for relief of psychiatric symptoms. Okay. Good job, folks. So this slide's already been shown, but it's just so compelling to me that the United States is a global leader, but not in a way that we could be particularly proud of. And so if you look at the overdose rates across the world, we are indeed the global leaders here. Estonia is the only country that comes anywhere close to us, which is a much smaller country than we are. This is really, for the most part, an American problem. You're seeing some problems like this in Canada, but not to the extent that we have here. And it's hard for me to think that the Americans just can't handle pain like anybody else. So I don't think it has to do with any kind of the human condition in the United States, but this is a real cultural problem that we have helped create. And again, it's a kind of a sad story of how we got here, but this is a sad reflection about what's happening. And certainly when I got into this area 10, 15 years ago, it was pretty much in Appalachia that this problems with prescription opioids